Hi everybody. We're live. Hi everybody, I'm Tanisha. Welcome back to the House of Medics. Thank you for joining us, and so sorry that we're on a little bit later than planned. Small technical difficulties, but yes, we are here. So as you can see, on my left and on my right, on my left and on my right, some lovely ladies. I'm gonna go ahead and we're gonna jump straight in, and I'll let them introduce themselves. So let's start on my right.
Hi guys, my name is Dayzee and I am a physiotherapist, the main therapist.
Straight. I'm Jen and Sabrina and I'm a physiotherapist.
Part of the main.
Yeah, part of the main's blue above green.
Blue above green.
So
We'll get into it.
Yeah, so I'm Jenny Okolo. I'm an occupational therapist and I'm also a daycare manager as well.
I'm Elle. I'm an occupational therapist. Green runs through my veins.
Wow. Okay, so as you can see, guys, there's a bit of tension going on. So these two ladies are physiotherapists, and these two ladies are occupational therapists. So before we go into the why you guys better than them, I'm going to tell you what I think each thing is.
Go on.
So physio to me, like Aaliyah always breaks her ankle. So physio to me is when you have to continually mend the bone, but it's with a doctor that knows how to mend it with exercises. That's what I think physio is.
Okay.
Is that correct?
No.
Right.
but it is a part of an entity of what we do.
Yeah, it's like one small part. We're not doctors, but you can call us doctors, we'll take it. But yeah, physio is an umbrella term, you could say, of different parts. So there's musculoskeletal, which was what you was describing, which is more to do with like the muscles and the bones and the joints and basically what you see. Then we do cardiorespiratory, which is internal. Yeah, your heart, your lungs, and all of those things.
These tubes down into your lungs, bringing up all of that mucus, all that nice stuff.
Yeah, and teaching you how to be positioned, where you can clear your lungs, teaching you how to breathe, to clear your lungs. Then we've got cardiorespiratory. Yes. Then we've got neuro.
Is the brain.
The brain, so how your brain affects you. So if people have strokes, have neurological conditions such as Parkinson's, MS, yes, and even cerebral palsy. So basically how the brain affects your body, and the brain is, there's something called neuroplasticity, which is the brain's ability to form new connections to help you learn new stuff. So as physios, we're basically meant to challenge you, which the OTs are going to say we're always challenging, which is
Yes.
Which the OT. So yeah, we've got neuro, then we've got like different aspects as well. We've got peds, which is pediatrics, which is basically looking after children. Then we've got elderly rehab, which is basically getting elderly people on their feet. Then we go community, inpatient, outpatient. You know that one, don't you?
And then the whole non-clinical side of things as well, research, all of those aspects as well, if you don't want to be seeing people daily.
So physio is broad.
Yeah.
It's not just massage.
Occupational therapist. So let me tell you what I think it is first. An occupational therapist, I think, is somebody that goes to people's houses and, because of like occupation, I'm thinking like house. And you offer your services on a more personal level. That's what I think an occupational therapist is.
Okay.
How did I do?
The right key words were in there.
You gassed them a lot.
So we definitely do go into people's homes as well. I mean, it depends on what sector you work in.
Yes, we do.
Okay.
Well, yeah. But essentially occupational therapy, and it's always quite hard to define, I will say, because we do so many things, but essentially we assess and provide interventions to help people live as independently as possible, function in society. That might be after having a traumatic physical injury. So we actually support people in actually just doing the things that they were doing before, or if they can't do what they were doing before the particular incident, is actually adapting the space around them or giving them techniques in order to do so.
So you guys would kind of act in a hospital setting or in a clinic setting, but you guys will go to people's homes to. Well,
we do work in
I
hospitals.
need to learn the difference today because
Right for you. So the difference is physios get you walking, occupational therapists get you sitting. I'm joking. I'm joking. An OT actually said physio. An OT actually said physios get you walking, occupational therapists get you dancing. So basically, let's say if you are finding it hard to put on your shoe, physios, we won't try and find an easy way to get you to put on your shoe. We're going to get you to be able to reach down and put on your shoe, whereas OTs will provide you with an equipment that will make it easier for you to put on your shoe.
Yeah.
See, they're making you lazy. I know, it's making you lazy.
Why wouldn't you fix the actual problem instead of providing equipment to?
So we do right. So everything that they were saying that they do,
You guys do as well?
Apart
Yeah.
from sucking out the chest, we don't do that part.
That's nasty.
That's no. But everything else in terms of physical rehab as well, we are very much involved in that. So I used to work in hand therapy, so we did a lot of that was exercises, that was splinting, that was doing more rehab, that was looking at neurological conditions that affect the hand and the nerves. So everything the same. So even if you want to call it musculoskeletal, we can kind of veer over to that side as well in terms of outpatient departments. The focus is different rather than what we do. So in a hospital setting, sometimes it can look very similar because we will both get patients up and walk them. We will both do functional activities where we might give them frames or walking sticks to aid mobility.
But physio, you guys wouldn't provide the frames.
They do.
Okay.
They do that side of equipment. We would look at adapting the environment. So the difference is the focus. So we are occupational focused, where they go for a medical model. So they look at the function that's been impacted by whatever condition they've gone through. Whereas we look at what occupations can you now not engage in or find more difficult because of what has happened to you. So more looking at, can you get yourself washed and dressed now that your arm's in a sling? How does that work? If you can't now grip a cup, can we give you a gripping aid that will help to make that easier? So it's not about stopping them doing functional activities, but it's realizing that if you can't engage, there are alternatives. Exactly, that's meaningful. Then we look at adaptations to help you keep going.
It's not terrible, I understand.
No, it's great.
Because especially for elderly people, they might not be able to do certain things, so they would require you guys a bit more, wouldn't they?
Definitely.
Okay, lovely. So let's stop the fighting for a little bit. I would really like to know how you guys got into your field. So let's start with physio. Talk to me about how you guys got into your field, your studying and all that kind of stuff. How did you even start physio? Did you even know what it was? When you saw it, was you like, oh?
No, I think me, I guess physio to most people is like, who's that guy running onto the pitch, like fixing all these football players? I want to be that guy. Realistically, you're not going to be that guy. Realistically, you don't want to be that guy because that guy is on call 24 hours a day, 7 days a week. He's the first one to arrive before all the rest of the team. He's the last one to leave, and he's getting paid peanuts. It's glamorized.
Don't forget the fingers.
So was that how you got into it? You found out what this thing was, and then you was like, oh, that looks good.
Yeah, no, so I think that's what I saw physio as, and I therefore wasn't really intrigued into it. But I think for me, I wanted to go along the lines of something where I was helping people, so like medicine-based in some ways, but I felt like doctors, they might be behind a desk. I saw doctors as like GPs rather than, I didn't realise doctors, the amount of like steps they would do inside of the hospital as well. So I didn't realise how active it was as a profession. So for me, to be able to do something similar to medicine, it was like physiotherapy.
But when did you know that you wanted to do something medicine related? Was it in school? Was it because you have family members that are maybe in medicine or in that kind of field? or did you just know from college or uni?
My brother wanted to do physio, and I thought, my brother's older to me, and I was always told, you're always copying him. And in some ways I kind of did. He did the sports therapy route.
Okay.
Because but he wanted initially to do physio, and that's how I heard about it. That's how I knew about it. When I found myself some work experience, came back to the mom, this is the one, I want to do it.
Okay, that's it. And you?
Me personally, I wanted to do medicine,
Okay.
but the grades were not grading.
Them one.
So I was, and I just didn't want to go to uni for the sake of uni. And with me, if you know me, I want to do everything. I'm that kind of person. So I started from medicine, and the way in which I wanted to go into medicine was, I remember I went to a hospital, and there was such a glamorous doctor that looked after me when I was a child, and I was like, I want to be like her. And that was it. So I was pursuing medicine, but the grades were not doing it. I did chemistry, biology, and maths in A-level. Again, grades not graded.
All right, me and maths have a very bad relationship.
No, but I really love maths. It's just the exam aspect of it. When it's put in a sentence, I'm just like, yep, they ruined it.
Yeah.
So everything wasn't making sense in A-levels. But then I wanted to do dentistry. I've always known I wanted to be in health related and to help somebody. So then I wanted to do dentistry, and I was told, well, why are you looking into people's mouths? That's nasty. That put me off. Then I thought, okay, let me go the social route. Then,
Can I ask who says that to you?
oh, plenty. Oh my God. So then I was thinking of different routes. So it's not until I did access to science, because I was like, you know what, let me come back to science, because I really want to do science. Then a lady was like, you know what, you're very hands-on, why don't you do physio? I was like, what's that?
Oh, so you didn't know what it was?
I didn't know what physio. Majority of physios and therapists in general don't know what their job is until they look further into it, and they're like, oh, actually, and that's why they always recommend that you have placement, because they know majority of us just, like, if you say physio, instantly people think massage. Oh, my back hurts, can you give me a massage? And it's like, that's not exactly, and that's what everyone thinks. I'm like, I don't do massage, but that's what everyone thinks. So when I did more research into it, that's when I was like, oh, actually, I could do this. But then I applied to uni, and they were like, do you really know what physio is? And I was like, yeah. What Sabrina said, the people that go on the pitch, and they're like, okay, go and do work experience, then come back. And I was like,
did you find that helped?
It did. But obviously the waiting, no one likes to wait. The waiting process was hard. So I was praying, and I was like, if this is for me, you give me placement. Then I did get the placement, and I was like, oh, okay, this is exactly. And I did the course, and obviously when you get in there, that's another palaver that you have to deal with. But yeah, physio, that was my journey.
Okay, awesome, thank you. Just before we move on to you ladies, guys, as you're watching and sending your amazing comments, please make sure you send a thumbs up, like the video, love the video, send the link out, do everything that you usually do. Let's see who's saying hi. Hi, Alexis. Hi, Aisha. Hello, Mami Morris. The Fashion Law Edit, is that one of you guys?
Hi.
Codrick. Hi, Codrick. Hey, Tamara. Everyone else just laughing at me. Cool. Okay, so occupational therapy. How on earth did you guys get into occupational therapy?
So for me, again, I didn't know what OT was, but I knew that I wanted to go into healthcare. And I was specifically interested in the psychiatry side of things.
Psychiatry is
mental health.
Yeah. Brain stuff.
So during sixth form, was it during sixth form or end of year 11? I can't really remember, but we had work experience. And I was lucky enough to have work experience at Maudsley. Yes, which is
specifying a specific.
So Maudsley is a psychiatric hospital. Most people know some people know of Maudsley. So I spent, I think, just a couple of days there, and I was able to see the different professions. And again, I was kind of scoping out, like, you know, where do I see myself fitting in? So I did that work experience, really enjoyed it, went on the NHS website.
Was this for school or for college work experience?
So this was, I think it was sixth form work experience. So everyone kind of went out to their different areas. I chose to go into that hospital. So when I got back, I went on the NHS website and I literally scanned through all the different roles, and I saw physiotherapy as well. But I thought, oh gosh, it's too much anatomy. I wasn't that great at like biology and that kind of stuff. Then I saw nurse and I was like, I don't think I can deal with injections. And then I saw OT and I was like, okay, there's a little bit of like, depending if you want to go into like the physical sector or mental health, there's a bit of both, as I'm sure it is with physio as well. But for some reason, I was just really drawn to it. Just a sense of like, I'm a problem solver. So, and I think that's kind of like the quality you need to have as an OT. We solve problems. Like there's not really a no. We don't take no for an answer. We will find a way. So yeah, I think that and then my experience at the hospital sold it for me, and I went through to university, and again placements as well solidified the area that I wanted to go into.
Was that full time, Monday to Friday? Just for you to see how.
Yeah. So I think.
Were you paid for the placement?
You're not paid. Was anybody paid?
No. Actually, during COVID, I was paid. Yeah, I got paid. Yeah.
I feel like the course is funded, so like you're not paying any tuition fees.
Yeah, that is true actually.
That is your payment. That's
we don't have any tuition fees.
We don't have a heavy student loan to pay.
That's true. So I do feel very lucky. But placements helped, and I did my placement in forensic mental health settings, so working with criminal justice and mental health hospitals, and absolutely loved it, and that's kind of led me to where I am now.
Nice. Okay, awesome. Thank you. And yourself, how did you get into occupational therapy?
Similar journey. Actually, I wanted to be a paramedic.
Oh, wow.
As a child, I went in Ireland a couple of times, and I just loved the way that paramedics responded. I was obsessed with kind of healthcare programs, so things like Casualty and things like that back in the day. So I watched them like religiously, and I was super like fixated on it. And I remember telling my dad, and he just said, "But the kind of lifestyle that you live and you want to live, I don't know if a paramedic's salary is going to be enough for you." And I said, "Well, what's similar to a paramedic then that does similar things?" And he said, "Well, a doctor." So I said, "Okay, let's be a doctor." And so from then on, I pursued the whole career down medicine right through to almost the application stage. So I did all the ASs that you're meant to. And I
AS?
Yeah,
AS?
the first level of your A levels.
Okay.
That you need to do. I had some teachers at school that just did not want me to be a doctor. So from the first, I remember my first biology lesson, a teacher came to me and he went around the class to everyone and said, "Why are you taking biology? What's it for?" And I said, "I want to be a doctor." And I can't lie, I'd aced my GCSEs, and there was no reason why he had anything to say. And he pulled me to one side and he said, "If your parents are pushing you into this, we can definitely discuss this." And I said, "No, I want to be a doctor for me." And even at parent meeting, he'd say to my parents, "You don't have to push her into this." And it was just the same kind of narrative that kept going and going. And basically, when it got to the predicted grades which you need to apply for university, he just refused to put my grade what it should have been. I went to the head of chemistry as well and was like, "No." And I think I'd scored maybe say a B already in AS. And I was going to resit an exam so I could get all back to the A's. And he said, "Doctors don't get B's." And I remember calling my mum, crying and being like, "Oh my gosh, what am I going to do?" And I thought, I'm not a fool. I'm not going to go and apply to medicine with below par grades. Like, that's just not an option. And I remember, we had this career guy at school, and so I remember on the day, because you have to apply for medicine earlier than everything else. I remember on the 15th just being like, I literally cannot send this application. So I was like, what else do I do? I was like, all I know is I want to help people, I want to work in health, and just be devastated. And him saying, "What about occupational therapy?" And I just remember being like, "What's that?" And he was like, "Look it up. Here's back then they used to have these journals of all the information of all the degrees." And I said, "Okay, let me read about it." The more I read about it, the more I was like, "You know what? This actually sounds pretty good. I kind of like this." And so then I did apply, And then I said, you know what, is education even for me? And I took a gap year because I said, I'm not really sure. Obviously, my mum, my parents were screaming at that. They weren't happy. They were like, why wouldn't you go to uni? I said, I'm not sure. And then the following year, I said, you know what, I'm going to go back. I'm going to go to uni. And then that's when I really started doing occupational therapy. And I thought, well, if I can convince them, uni, that I want to do it, then maybe it's the path that I went down. And not to say OT has ever been easy. It's not populated with ethnics, and so the route for us looks very different than it does to our counterparts, and that is from student level all the way through, and so it's never been an easy journey, but I made it to the other side.
Yes,
Round of applause. Okay, cool. So let's move on. I would like to know the pros and cons of OT. And do you guys have like a little nickname for your thing? Because it's quite...
PT, yeah, OT, PT, yeah.
OT and PT. So can you guys tell me the pros and the cons of being a PT?
Not the competition part.
Yeah, do that. Do that.
Go ahead.
So basically they're beefing, guys, just in case you haven't noticed, they're beefing.
Come for next straight away. The good pros about physio compared to OT is the uniform. Okay, guys. Okay. Wow. Look into the cameras. We are in uniform. So you would like to look. No. If you'd like to Google the uniform that OTs wear, the green is not flattering.
You guys always look like you're going to exercise. Like
Exactly. Would you not like to go to work in casual clothes?
Peak
Peak or every day.
literally
Every day.
peak.
You don't have to. And the green. So that's a big pro. Physios wear blue, navy blue, while OTs wear.
This is coming up as an occupation.
No. It's a green. Yes, that's what they wear. Exactly.
Green and white?
Yeah.
I mean, it's not bad. It's not nice.
Exactly.
It's paramedic wear.
that's true.
You see?
Paramedics wear green.
No, green. That is a different tone. Exactly. It's a different tone of green. It's a different tone of green. So that's a big pro.
Let me Google what a physiotherapist is.
Exactly.
No. See, this is the thing about OT.
Sometimes they
always
wear
try and be like
I'm back.
yeah, very confusing, right?
Confused. What's going on? This is like a PE kit.
Exactly.
Let me show you me wearing my uniform and I'll let you know.
No, that's not the physio. That's the patient. Let me see.
Wait, the patient's wearing a PE kit.
Guys, this is not.
Can you please Google what each wear?
This is the physio. Well, so if you're
Green is my favorite color.
not that kind of green. So this is the ward. This is what we wear on wards. It's called a tunic. But then it's similar to them, But then out on a normal day, we wear a polo top and tracksuit.
Yeah. See, I don't know.
I'm going to do an interview. They're both awful. Right? It's a tie.
See?
It's a lot more casual. This looks like PE kit, but it's a lot more.
No, but in our defense, we have to get down and moving. Like we're always slow. See, she's
I spent a whole stint in orthopedics, and that's all we were doing.
That's true.
Exactly the same things as the physio.
No, we do love them. We do love them.
No?
Green is my favourite colour.
Is it that tone? What green is your favourite
I like
colour?
all shades of green.
You have to say that. You have to say that.
Ask anyone that genuinely knows me. I love every shade of green. I'm just mad.
Money.
I would say one
Money.
I would say one big pro is that never on the ward am I called an OT. I feel like that's one big thing for you. You're always called physio.
Because of your outfit,
Wow.
Oh, it's true, isn't it?
Yeah.
It's true.
I feel disheartened. I'd be like, I did a whole 3 years of uni to then be called
Physio is we're physio. And another pro is when we say we're a physio, they like, oh, okay, at least they go with massage. But when you say you're an OT, what's that? And the first,
Do you know
at least you guys have a song. At least you guys have a song. As soon as you say OT, they go OT, OT. You know that.
Oh no, you did not go there.
I don't get it.
No, you know that Drake song.
It took me a minute to put two.
No, but a pro about both of our jobs is the fact that we help people. We're very hands-on and we just want to get people back to their baseline. So even if you can't get them back to their baseline, you find adapters to help them. Exactly. And that's when we work beautifully together. As much as, yes, we like to make it seem like, yeah, we're always against each other. They rely more on us than we do on them.
I did see, I saw a comment from Alexis on here. She said, sorry, Doc, if you could help me scroll up. I don't know if we're going to find it because there's so many people laughing. Alexis said something about...
Someone's been a doctor for 6 years.
No, that's Dr. Emma. She said something about you guys helped me so much. Who is it? Am I being blind?
Yeah, she said not for the
Yeah.
after being a doctor for 6 years.
Yes.
No, that's Dr. Emma. She said working in geriatrics, you guys help us, you guys keep us moving, love you guys. So obviously you guys are doing something.
We are. Lots of people have been saying that they love the green, by the way. There's a few.
Yeah, it happened.
See,
Receipts right there.
Okay. Let's give them that. We'll give them that, Sabrina. We'll give them that.
We're still up here.
We'll give them
So guys,
that.
as you're watching, please make sure you're sending in your questions for OTs and PTs as well. If there's anything that you really, really want to know, please make sure you send your questions in. Nana, I'm expecting questions to be sent in from you because I know you're really interested in this stuff. So make sure you send your questions in. Okay, cool. So I would like to know, what is a typical day in the life? Oh, didn't we? Oh,
come on.
Sorry.
Sorry.
So that's your pro. There we go.
So I think a big pro is the fact that we do both physical health and mental health. So we bridge the gap of both departments. So
Yeah.
we have like mental health sectors where
Which
we
is me.
Yeah, and we have physical settings as well.
So PTs don't do anything to do with the mental health.
No, we do. Okay. We do. So that's what people think, that PT don't do anything to do with mental health. However, what do they say about exercise and mental health?
It helps. It definitely helps me.
That's all they do.
It really does.
That's all we need. See, we're straight to the point. We just go bam, and we don't like to dilly dally. We're just.
But we look at the whole integration back into your normalized life, which is a huge thing.
We do it as well.
If you have kind of a mental health crisis, so I used to work in eating disorders. So simple things like just being able to go out to restaurants and order food. People couldn't do that who had been institutionalized for such a long time. So we would literally take them to restaurants and say, just order a starter, eat the starter, and then go home. Let's just go to a clothing shop and let you buy something where you haven't been able to wear that size before. Buy it, come home. Let's go and do a little food shop, come home. Physios don't do that, and that's not really their remit to do, but it's about looking holistically at a person and not just saying, oh, now you're back to your function, that's okay. And function is important, that's a huge part from our side as well, but it's not the only thing that's meaningful to a person.
Okay.
If I can walk from here to here, but my toilet is from here to the other room, walking from here to here is not going to help me reach my toilet. So I'm still going to need another aid to help me get there. And so we look at, okay, do we need to give you a piece of equipment that's going to make
you get there? Yeah.
And so there's a huge amount of that, which is a huge pro, because we don't look, I think we're one of the few in the hospital that don't use the medical model as our frame of reference. So it's not about the function being the main element, it's about what does that function enable you to do. And so a lot of our patients have really positive things to say about their interactions, because everyone else has said, have you taken pain relief? Have you walked today? Have you done this? But we'll say, actually, what's it going to be like when you go home? And they go, no one's asked me that yet. Or what did you used to do before? What kind of person were you before? And that's sometimes the first time they have that question. And so I think that's a big pro.
Okay,
Let me defend physio. Let me defend physio on that side. So physios, and this is the good thing about having these discussions, because until you have these discussions, that's when you know what somebody's role is, because physios actually do look at a person as a whole. So with physios, we have the ICF framework, which is the International Classification or Framework of Function, which looks at a person's social life, their current life, their baseline, their family life, and tries to include all of that in their rehab therapy. So yes, we're more function based. However, we will ask you, how far is your kitchen and your toilet? How far is the walk from your living room, where you spend most of your time, to your bathroom? And that is the length that we aim to get you to. And on top of it, we think about your social life, because we know the importance of mental health and the importance of seeing a person as a whole. If you go from you used to go out every time, and now you're sick, or your function is reduced, so you can't go out as much. We think about, okay, cool, what can we do to aid that? So we think about putting adaptations in place as well. So let's say you can walk, let's say from here to the main door, but you can't walk further. We'll think about, okay, what about giving you a let's say a relator frame, where you can sit on it when you're tired, just take a break, to get you to where you're socially happy, to get you back there. And on top of it, we also think, okay, when you go there, how can you engage in activities? So see, this is the thing.
Surprise is the truth.
I know. Honestly, I'm really surprised.
You must be a rare breed of
but we do actually make it happen. In honest truth, we see a person as a whole, not just we're trying to get you up and going. And that's why physios do a lot of MDT work. So currently I'm working with
what's MDT?
multidisciplinary team. So we work with doctors or like different departments to basically help the client or the patient get back to the normal living. So I'm currently in LD, which is learning disabilities, and I work with adults with learning disabilities. So if I go to a person's house, yes, I'm more function based and thinking about their body and their posture and their alignment, trying to think about their body as a whole. However, if I go to a person's house and they go, okay, my wheelchair is broken, okay, it's my duty to call wheelchair services. No. I actually So see, with where I work, I guess we're too nice. I guess we're too nice. We do the referral because we can do it. We like to help each other, so we do the referral ourselves. No, our OTs don't do it. No, we do it directly.
Can I ask a question? So would you say, because this is going to be mad, would you say that the more severe cases go to OTs?
No.
It depends. Right,
but I say that to say it depends what it is, because from if it's severity in a functional perspective, the physios are probably going to take up the lead in certain areas with that.
Okay.
But then,
so you guys actually work together?
We do work together.
No, you guys are ridiculous. I'm sorry. Wait, I can't believe this.
They don't know the difference between them. And as I said before, our roles do intertwine a lot in terms of similar assessments that we do, similar things that we're looking for at different stages. So the lines are really blurred, especially in like hospital settings. I know we kind of set you up there a little bit.
I call some beef here, but think about OT and PT as like Nigeria and Ghana.
Ooh. Ghana's better than Nigeria, but we're not going into that.
We're not getting into that.
Hold on.
How would you notice? I need to. We're like, we can work together and they're like against us.
Alexa and OT, but we're going to go for some of the questions shortly. Really interesting to get insight into this. As a med student, it's not often, I feel like my eyes are getting bad. It's not often clear what OTs do. I can't read the person's name. I also urge medical doctors to use and include OTs. It's such a massive help for you and patients to have that relationship. Someone says, I've never once come across PTs who do that stuff laugh aloud. And even OTs
I'm not gonna lie, anything paperwork related, it's going to my OTs.
And then Johnny said Dayzee is definitely a rare breed. See, Dayzee is definitely a rare breed of PT. most PTs in acute hospitals won't do this. What's an acute
No,
hospital?
that's in inpatient. Okay. No, but I guess it's because of how my placements were. So I had educators where they were like, if you need a patient to walk to the toilet, walk the patient to the toilet, help them in the toilet, help them wipe their bottom if need be, and walk them back.
Have you done that before?
Yeah. Like we do. It's part of my job. No, it's part of my job. Instead of me waiting for a nurse to just turn up, I'll just do it. What's the point? Because
there are occasions where I won't do it. It's not my role. It's not my role.
I need to see the
If I need to see
patient.
that patient and I'm on a time scale and I'm doing
Exactly.
something,
I need to see the
just
patient
hold my nose
and just do it. Exactly. No, but PTs that I know, okay, myself and Sabrina, okay. Let me conclude that, even though she said she doesn't do it. But PTs that I know, we actually are very hands-on. But I guess in my defense, I've been with very nice educators and mentors that would be like, just do it, Dayzee. I'm like, but is it my job? No, okay, I'll do it.
I think it's also the acute hospital. I feel like the professions are very similar and can complement each other quite well, working together quite well, and they kind of get bunched into two of the same in the hospital. And I'd say that
You guys.
it's like doctor's plans, OTPTs with a slash between because they don't know the difference between which one they should actually be referring to. I was actually speaking to someone who actually did the lectures for medical school, and they're saying that doctors only get half a day or a lecture or something on the difference between the professions. So I don't really blame them in their like 7 years not to know the difference. You can't blame them. Because I have met some consultants who actually do know the difference, which is quite nice. But I'd say a lot of the like paperwork side and the discharge planning side goes to OT
Definitely.
But me working in the private industry, actually, what I see.
Private industry, eh? I had to throw that in the private. Anyone else work in the private industry?
Technically, we want to be technical. I'm joking.
No, but I say working in the private industry, I say actually we cross-correlate. So at the moment, I'm seeing someone who's had like bilateral, like
What's bilateral?
Both sides of the legs. Like
Bilateral means both.
both.
You guys are so medical.
Two lateral sides, so two sides.
Right. Okay. Bilateral.
He's torn basically both his thigh muscles, and they've been surgically repaired.
Did he do that?
That's not good. I can't go into
What's it
those
called?
things.
Patient
confidentiality.
That one.
Yeah.
Patient confidentiality.
So with him, there's a lot of stuff where I've worked closely with OTs. I was able to, adjust his commode to the right height to make sure it was correct.
That's his what? Sorry.
His commode, the thing that he that's it. I was gonna say it in a very different way.
Okay.
So I was able to adjust him with those things, and I'm able to do some of the OT roles, which I say making sure his mood, his cognition is okay, things like that. And I would say that
We do make it happen.
I think working together and where you, as a student, is where you work together the most and you learn most from one another. You can actually complement each other and do a bit of each other's role.
I love the answer that you've given. That's awesome. So basically, you guys have been arguing for no reason because you work together. You guys work
In
together.
some settings, I will say.
Oh gosh. Okay, let's go to some of the questions on YouTube because there's quite a few. I don't want us to move them. So we're gonna go from the top. And anyone can answer. How do you ensure? Actually, Dayzee, I want you to answer the first question. How do you ensure a good co-working session between an OT and PT?
Communication and respect is very important. So just respecting that you don't know everything and communicating what you don't know.
Okay.
And that's very important. And that's when you work good together. So and being open to listen as well, not just talking for the sake of talking, but being open to listen as well. So if I come to you and I'm like, oh, so I have this patient that this is their condition, this is what I've assessed, their range of movement is this, that. How do you think I can improve it with equipment? Because I don't think we can do stretches. However, what can we put in place? I need to be willing to hear Elle or Jenny tell me, okay, Dayzee, well, this is not good, this is what you can do, and just accept it. And that's the way in which you work effectively together, knowing that, yes, it's not your role, but it's fine. You don't know everything as well. And that's why we work. That's why we have colleagues that are there to support us. So that's how I would say you work effectively together, just respecting each other and just speaking and just accepting that you don't know everything.
Together.
Exactly, for the good of the patient. Because at the end of the day, you want your patient to go home well and not come back. So how do you do that? You work with your other teams. And I guess even with doctors, and that's why doctors really appreciate OTs and PTs. Doctors do, let's say, a little bit of suctioning. They don't do really intense suctioning, whereas physios, we suctioning, basically taking mucus out of the body.
Suction, you know.
Exactly. So if physios, we're very good on positioning a patient to get enough, a lot of the suction out and get a lot of mucus out of the lungs.
Why would that even be a thing that a PT would do?
Exactly. Cardiorespiratory, as I said initially, is more to do with the lungs and the heart and how they work effectively together. So if someone can't breathe, majority of the time they've got stuff in their lungs that's stopping them, that's reducing the lung capacity and stopping them from being able to breathe. So that's when we come in and teach you breathing exercises to work those things, work your lungs and to work your diaphragm and to get you breathing properly.
Just using those muscles around, just thinking about kind of x-rays in the sense of like the bone structure of
the lungs, basically, And doctors are not good at that, so they would come to a physio and be like, "So show me how you do that again." But
that's shocking. You would think a doctor
you would think, but they don't, because they are so broad. They don't spend as much time as we do on stuff like that. But it's just willing to be humble enough to be like, "Oh, can you show me that?" And just us also willing to be like, "Oh yeah, I can show you that."
MDT working is so beautiful.
Exactly.
If you work together well, it works.
So really, you guys need to be like besties.
We are besties.
Outside of the day, but actually,
You have to actually work together.
Okay. So the only other thing I would say about good co-working is understanding each other's roles within different sectors. We work in many different places.
Exactly.
Within the hospital, outside the hospital. And if you don't understand each other's role within that setting, that can cause clash, because as I said, there's lots of moments where our assessments seem like they blur into each other. So sometimes it's saying, I need to do a wash and dress with this patient, so I'll just mobilise them first, rather than you walking them 20 minutes before I come in, they're flat out tired. They don't want to work together. Sessions, so it's understanding that our roles can blur and understanding that as well.
Thank you. Sabrina, I have a question for you. It says, if you don't mind sharing, what are some of your ultimate goals in your career?
Ooh, 5-year plan, guys. Ready?
Nice.
A cup of tea ready. I've got my water. No, I'd say my 5-year plan. So my heritage-wise, I'm Indian Kenyan. And so I had there's a lot of us. There's a lot of us. So I did my A-levels out there, and I fell in love with the country, and I would love to be able to be there 6 months of the year and be here 6 months of the year.
Luxury living.
Yeah, I'm looking hella pale right now. I need some sun. I need some melatonin. So that would be the perk of it as well. But ideally, so I've actually started up. I've set my own clinic in London, in West London, and the plan is to continue with this clinic, but also maybe set up a clinic in Kenya as well.
How old are you?
Ooh, I look 16 in it.
Just like half to 16 and a half.
16 and a half?
I'm actually 24.
Yeah, that's good.
Yeah.
That's amazing. You're 24 years old and you have your own clinic.
Exactly.
That's amazing.
Absolutely amazing. That's amazing. Amazing.
The huge thing.
So that's the plan. So set up clinic here, jump over to Kenya, be in Kenya 6 months of the year, be working clinic based, three of those 5 days in the week, working days. And then 2 days of those week doing stuff like what the warehouse medics do in terms of outreach, and going into the communities where healthcare isn't so accessible and providing support.
In Kenya. That's amazing. Lovely. So I hope that answered your question, Alexis. Oh, there's so many questions. See, everyone's like, wow, amazing. No, that's amazing. We'll touch on that a bit later because we want to know how we can follow you and all that stuff. But what does a mental health occupational therapist do?
Good question. Very good question. So I work in mental health, obviously. So the type of work we do is mainly assessments to do with either integrating the person back into society after maybe being in hospital for a long time. So a lot of our patients, when I was working in hospital, are sectioned under the Mental Health Act. There's various different sections depending on the crime that you might have done or like how long they hold you in hospital for. So OTs work alongside the MDTs in terms of integration back into society after your time is up in the hospital. We also support people with the cognitive side of things, so their processing. Oftentimes, especially if they have a mental health condition like schizophrenia, which I think most of us know about, it does actually impact the way someone thinks, and the things that they were able to do before, perhaps maybe going to work, going to school, it's really difficult to go back into that.
Just in case people watching don't know what schizophrenia is, can you just explain?
So schizophrenia, I don't know if my definition will be good, but essentially it's a mental health condition. It can come in the forms of auditory, which is maybe hearing voices or seeing things that aren't there. There's different forms of schizophrenia as well, but essentially it's a type of psychosis that a person goes through, and it can be caused by various things like trauma, drug-induced psychosis as well. So it's quite it's a sad mental health condition, I would say, and however, it doesn't mean that, and that's where we come in as well. Like, we do support those with mental health conditions to actually live with that as well. So as well as medication, as well as all these other forms of interventions. Oftentimes, and I think that's probably because of how society has portrayed mental health, it's almost like that's the end. There's no hope for them. However, there is definitely a chance for them to go back to normality. It might not be the same way that it was before, but actually seeing if there's different ways of doing the things that they were doing before, like maybe working and things like that. So that's in a nutshell mental health occupational therapy. However, so where I work is, so I work in forensics. So the criminal justice system, I work with prisons, and you wouldn't really think that an OT works in them, but actually there's a whole inpatient unit in most prisons in the UK. And sometimes we do have physios as well. We have social workers, doctors, nurses. And again, as OTs, we help them with the skills to kind of do their ADLs, so activities of daily living. Yeah. ADLs a lot. We just help them with the skills to kind of function again.
Cool, thank you. I hope that answers your question. And there's a lot of questions for you guys, actually, the OTs. Where's the question that I wanted to ask?
No, it's because no one knows what they do, so it's just
I think it's curiosity.
I didn't know.
And curiosity killed who? It killed the cat.
Where was the question? Can you say more about the different settings that OTs work in? So you mentioned prison. Do you know any different settings that OTs would work in?
So many. There's just so many sectors, because any place where someone needs to either reintegrate back into society or find a new way of adapting what they're doing already, we're involved in. So there's obviously places within the hospital, most kind of teams that you've got, orthopedics, elderly, specialist medicine areas, oncology, where I work in, pretty much most of respiratory, we work on pretty much every ward in the hospital. And that's just acute settings where we kind of get people ready to go back home safely. Then you've got the community sectors where we can work in rehabilitation, so alongside physiotherapists. You can work in places like prisons, from kind of a mental health perspective. We can be assessors for disability within the community, called PIP assessors. We can work in like eating disorders, social.
So there's a whole array. Yeah.
There's so many.
Okay, lovely. Thank you. Sabrina, this question is for you. What are your top pet peeves from patients and other healthcare professionals? And be completely honest. Don't hold back.
Oh, if you know me, I keep it real. I won't hold back. I'd say one pet peeve from patients is don't book your next appointment with me up until you've actually tried to give your rehab attempt, because you're just coming back and we're doing the same thing. You're spending money, wasting money, like for no reason.
That's from a patient.
And I know when you're not doing your exercises.
Yeah.
When I say to you, show me your exercises, and you're like, You know that
I did yesterday.
I tried it yesterday, but I know when you're lying. Guys, don't do it. I think that's my biggest pet peeve when it comes to clients. And I'd say when it comes to other clinicians is communication. Yeah, I think as clinicians we can achieve a lot just by effective communication. But I feel like and it may not be the clinician's fault, it may be the environment, in the sense where we're bombarded in terms of our caseloads and we're overworked. So therefore we do not sometimes have the time to effectively communicate. But I think if communication was better, especially if you're looking at the NHS model of healthcare, I think a lot of our issues would be resolved through effective communication throughout the MDT, throughout admin staff, everything. I think that would be my biggest one.
Busy Bee Bailey says, can Jenny talk more about her work in physio? Sounds great.
I can't read anything.
Oh, in prison. Sorry, I can literally. Sorry. Yeah, can you talk more about your work in prison? It sounds great.
Okay, so obviously it's quite a unique setting to work in, but I should say that I am an occupational therapist, but I'm also a daycare manager. So I manage a Wellbeing centre within the prison. Okay. But we do have various OTs as well who run groups. So we run groups like Creative Space. So very, very similar to art therapy, but we create a space where the prisoners can kind of explore their creativity. And within that, we assess how they socialize, how they interact with other people, even simple tasks or simple to us, like maybe creating something. We'll see can they process the information that we give them. And that's all part of the assessment, depending on what their needs are. We also do sensory assessment, so that's been quite a big thing within the prison system, because we do have a lot of prisoners who unfortunately have like undiagnosed LD, so learning difficulty, ASD, autism, and obviously, as you can imagine, the prison setting is it's not a nice place to be at, and alongside the crime, the types of people that we do get in, and then on top of that, having some sort of learning difficulty or sensory difficulty, it's quite hard for them, and it can definitely worsen their mental health. So we work on the sensory side of things. We also support prisoners in getting work within the prison. So again, just enabling that independence and almost mirroring society, so that when they are released, it's easier for them to transition back into the real world in a way. So that's just a little snapshot of what we do here.
Thank you. So if this person wants to know more, can they speak to you on socials?
Yes.
They can definitely reach out.
Definitely reach out. Yeah, definitely.
Awesome. I have a question regarding what you said about mental health. Actually, I know we're meant to be rounding up. We've been talking for a long time, but how do you guys manage your workload? You speak to people that have mental issues. So how do you guys actually manage your workload? Have you guys ever been just burnt out and you're just like, I can't do this anymore?
From a mental health perspective?
Yeah, from a mental health perspective, yeah.
Myself personally, I have things that I do on the side as well. So I'm a hair and makeup artist, and I'm an event planner, and I'm a host and presenter as well. So I can switch off in the sense of I do work and I get home and I do other stuff. And also, I love my sleep. I must rest. I love to sleep. I make time. I know, no, honestly, I make time to rest and relax, because problem no the finish, as they say. There'll always be something to sort.
that's it,
And
that's it.
if you make your mind up that I'm not going to be stressed, that's the way forward. And being sociable, like not just keeping yourself to yourself, but being sociable and being able to talk about what you're going through. I guess that's where people lack communicating about the things that they're finding difficult. Me, as I said, I'm a problem solver. I want to find the solution to a problem.
Your way to de-stress and help your mental health is talking about
It and doing stuff, basically keeping myself entertained by different stuff, like finding different stuff to challenge me or incite my brain, if that makes sense.
Okay.
So yeah.
And Sabrina, what do you do?
I'm going to give such a physio answer.
You exercise.
I exercise. I go gym sometimes, and
No, that is like the best
It does
thing
help.
ever. Oh
It
my
does
gosh.
help. It does
the
help.
thing for me is I love walks, I love mountaineering. I've done like
You love what, sorry?
mountaineering,
Oh,
so
okay.
like mountain climbing and stuff. So I've got one left of the 3 peaks in the UK to do.
Oh, wow.
I've done, like,
Flipping
Kilimanjaro.
Wow.
Yeah,
Oh my gosh.
It's home country, so it has to be
good.
done. Yeah.
Wow. Okay.
Yeah, no. So
You're an outdoor person.
I'm an outdoors person. Yeah, I hug rocks. Not so much trees, but yeah.
You hug rocks.
I'm not quite a hippie, but like.
I mean, no, I'm joking.
She's a rocky.
Yeah, lucky, no. Okay, awesome. And you ladies, what do you do to kind of make sure you don't burn out? Or if you do burn out, because it happens, what do you do to kind of recover?
I think within the workplace, I keep a diary. Like, they know me at work. You cannot see me without my diary because I tend to forget things, especially when I'm really overwhelmed with like reports, meetings, walk around.
Diary as well.
So yeah, keeping a diary just to keep track of all the tasks I need to do and prioritizing, and also understanding that you don't have to do everything in one day.
Yep.
I think especially as clinicians, we sometimes feel the pressure, whether that's from above or from whoever, to try and finish this big report in one day. I mean, that's ridiculous. I mean, sometimes we do have to do that, but like just giving yourself grace enough to prioritize just the tasks that need to be done. And then also, of course, speaking to your supervisor or your manager. And I'm giving a very much clinical sort of advice, but that's what I would do anyway to help with that.
Well, I'm a health and wellness coach, so I have to spend a lot of time talking about my well-being and other people's. So in the workplace, I run a lot of well-being sessions for my team, so whether that's like relaxation, last week we did mindfulness, even if it's just kind of a 10-minute something, we do that. And then I try and prioritize that.
Your demeanour is very calm, actually. It is very, so I get
Calm
it.
voice.
Yeah.
And so yes, I took up a new hobby last year of roller skating, so I try and do that at least once a week, and just to kind of de-stress. So I guess a combination of what everyone else does in terms of how I manage my well-being day to day.
Lovely, thank you. And San, we're going to answer this question. This is going to be the last question because I'm assuming that you're a student, and we're trying our best to cater to the students. So, any advice on going on OT placement?
Yes, lots. Write things down. Ask lots of questions. Be present when you're at placement, because unfortunately you're in a vulnerable position when you're at placement. Everyone's watching you, watching what you're doing. There's lots of people that can report back about how engaged you were, etc., etc. And I think some students go into the setting thinking that they're untouchable, and you're there to get a grade. And so you're there to learn and be exposed. If there's any opportunities for you to go elsewhere, take those opportunities. If they say, do you want to work on a different ward and see something, do very much that. But definitely keep a track of what you are doing and completing on placement.
Okay. I just pulled my mic out, so I'm not sure how much you guys can hear me.
Oh, good.
Yeah, okay. I'm not sure if you guys can hear me. I just pulled the mic out. My apologies. I hope you guys can hear me. So I'm a student. Right, quick scenario. I'm a student.
Yeah.
I'm about to go into physio or OT. I'm literally about to choose which one. can you sell me the roles?
Oh, what job which
So
field to go
it's up
into?
to you guys which one I'm about to
let OTs go first.
So, I mean, do you want a moment to okay, I'll give you like 10 seconds each, so we'll just wait for it. You guys can think of your answers. Say it.
I felt like I need to
Go.
Okay, so who wants to go first?
OTs will go first. It's fine.
Oh, is that what?
So
Oh.
it's gonna be physio.
Okay, go on.
Okay, so
Sell me the thing. Like,
I should tell you physio. Okay, so physio is the best. No, I'm joking. So with physio, we think about everything as a whole. It's very medical related. However, it's very rewarding in the sense of you finish your day knowing that you've actually helped someone feel better. Imagine not being able to work, not being able to walk and having someone get you up and moving. Imagine how that feels. And that was one of my placements, my elderly rehab placement, where I got someone from not being able to even sit at the side of the bed to being able to walk. That's what really stuck to me till today. And
I feel like this is emotional blackmail a little bit, but I'm here for it. But it's okay.
Wow.
I feel like
They sent her. They literally sent you. The OTs have sent you.
They haven't.
We don't do much.
You're selling it to me, but I feel like you're playing. You're trying to play on my
Should I end
emotions.
it? Yeah.
No.
You know what physios do, you don't know what OTs do. So in short,
It's true.
Wow.
It's true.
Mike, where's my mic?
I think one of the biggest things for me is say someone's had a stroke, that's a life-changing thing.
Exactly.
Complete side weakness.
And to be able to use
the way
it.
that I see it is, the pleasure that I get from my job is seeing that person's face when they do their first stand up and seeing their family so excited for them as well. And then you're able to
It's
be
very
a part of that.
rewarding.
Yeah,
Very
it's
rewarding. Very,
I'm
very
not gonna lie, if you're going in it for the peas, it ain't there.
No.
It's not there at all.
Wait, so I remember I got into third year and I was told physios start at a 20k mark. I said, 20 who? I said, I'm going home. I quit. So it's not for the money.
It's not for the fun. It's not for the money at all. But if you are interested in helping people, I think go for it.
Awesome. Thank you guys. I'll let you know my decision at the end. Okay. Audience, I need you to start sending your votes in. If you're for PTs, physiotherapists, be sending in your PTs with emojis. If you're for OTs, be sending in your OTs with emojis. So OTs, over to you. Why should I have a role as an occupational therapist?
Imagine a role that is flexible to whatever you want it to be. There is no specific way that you have to do something as an OT because it's all about what's meaningful to the client. There isn't a specific tool that you have to use. If you can justify it, go ahead because it's all part of that patient's journey. Imagine not having to be in the hospital. You can be in the community, you can be in mental health, you can work in workplaces and businesses, you can work in wellbeing and having all this skill set to do whatever you want to do. You can go into private practice if you really want. You can travel to different countries and still be an OT. And be able to
It's
do
the
that.
same with us.
You can travel as well, can't you?
Exactly.
Yeah.
Thank
You
you.
can work from home as well, can't
Thank you.
Also do all the things that physios do in terms of the stroke patients and the rehab pathways. We still are very much there. So if you want to be hands-on, you can. But if you train as an OT, you can do any of them. You train as a physio. There's
A bit limited.
I just, when we spoke, I told you that everything they do, we do as well, in the sense of they deal with more equipment. They just order you stuff. Who cannot order in this day and age? Please tell me. Amazon is there.
You know what? I will say, I remember when I was doing my course, I saw a lot of physios on the OT course. Why is that?
But someone
Because
just said,
yours is basically, it's like, okay, so the difference is basically the difference between eating chips and eating,
votes are
let's
coming
say,
in, guys.
a 3-course meal, okay? The physio is a 3-course meal, okay? You get the starter, main, dessert. Theirs is easy. It's always chicken and chips every day. If that's what you want.
chicken and
If you're
chips.
I feel like if you're straight to the point and keep it real, like myself, yeah. physio's for you. Straight up, like you keep it straight to the point. You don't fluff things about like all of us come from an African background.
Yes.
Straight to the point.
Yes.
If that's you, physio's for you.
Jen hasn't spoken yet.
Listen.
All I'm saying is there's another OT to speak, and already.
Exactly, and that's what I keep saying. We don't need to say too much.
This is it.
Just talking about the progression side of things. So obviously, I'm currently a band 7, and
What's the highest band? Is it 10?
what is a 9 though?
It's 8.
I think maybe. Yeah, and
Yeah, she
do you
is.
know
Are you
what?
a senior OT?
I'm the lead OT for my.
Sorry then.
It just kind of shows you the progression. I'm sure there's progression for you guys as well, but especially in occupational therapy, there's a lot of emphasis on professional development, and there's so many opportunities. What am I looking at? There's so many opportunities. There's so many opportunities within this sector, and again, like for me, knowing that I have the skills to go into so many different places, I have actually thought, like personally, if I don't want to work for the NHS, where else can I work at? I've done prison, I've done inpatient hospitals. So now I know that because I have so many friends in maybe the education sector, I can actually go into that area, or, you know, whichever one. We're very flexible. There's so much opportunity for growth. And, you know, the money is not that bad, to be honest with you. Like, the higher up you go, the...
And I would just say on the subject of that, I'm about to change roles into education.
Why is she
Well,
leaving?
Right.
Why is she leaving? This OT is so good.
I'm not leaving occupational therapy. I'm becoming the lead of allied health professionals for development.
That is amazing.
I'm trying to develop
Wow.
all, including physios, because
Love
I want
it.
everyone to have the same options.
Okay, love it.
Yeah.
Okay, guys. I would say-
Let me add one more
Go
thing.
ahead,
Okay.
go ahead.
There
Go
is a
ahead.
shortage of OTs for a reason. Just saying. Drops another mic.
Okay, so if you can scroll up for me, please, Dr. Ava. I just want to read a quick comment, and then I'm going to cast my vote, and then we're going to go into what everyone said. If you
You gotta
can,
be neutral because
if
we're
you
right
can
next to you.
just, got to keep it real, guys. It is what it is. I'm not sure who that is, but it says occupational therapy also working in roles maybe not called than in other places. For example, private sector charity, your own business, etc.
I think I understand, or I hope that's what I understand. But sometimes we work in certain sectors where we're not actually called OTs.
Oh, okay.
So I remember when I was a care coordinator in the community. I was a care coordinator, but I was doing mainly OT stuff as well. So that tends to happen a lot as well.
Okay.
Right, so Aisha says OT, Sam says OT, Dolly says whatever PTs do, OTs do more holistically. OTs for me. The fashion law editor says OTs for me. Exactly, we're very holistic. We look at every part of you. Wow, I don't mind PT ordering less work for us so we can do other things.
See, as I said, that's fine. However, there's still a shortage of OTs. Why is
after
that?
looking at the comments, it's looking like there's going to be a lot more
There's
OTs to
still
be
a
honest.
shortage.
I want to send more of my paperwork.
Exactly. We don't mind, but there's still a shortage. That's fine.
There's a shortage
But then you
of
come
all
back. It's
professionals.
okay.
Yeah, we're all on a shortage.
We're all
At the
NHS.
moment, physios are doing very good.
Okay, guys. Okay. And then someone says we are fairly new professionals, so scope to make it great.
Yeah.
Okay, so it was really good. It was very enjoyable. I have to be honest though, it still kind of seems like it's kind of the same thing. But I think you guys spend more time with the person, and I think you guys kind of go for like, okay, that's what you do, blah blah blah, and then. No, I'm just saying how it seems to me.
I would say in relation to that, I think yes, you're along the right lines. I would definitely say
It's not a bad thing.
No. I would say like I would say the biggest difference between PT and OT is I feel like OTs focus more on a cognitive model and looking at kind of like the brain and how the brain is impacting their day-to-day function. I would say from a physio point of view, you're looking at your. Wait, let me finish. But I feel like from a physio perspective, you're looking more on a muscular level as to what muscle entity is kind of causing you not to be able to perform to the function that you want to function to.
Okay. Can I vote? Can I first ask what you think I would vote?
I think you're going to OT, I can't lie.
Right.
I know physio is better, but I feel like doing OT, they sold it quite well.
Yeah, but that's
Depends on what, like.
Yeah, that's me, our thoughts, but
What do you think?
you shouldn't have to sell something if it's that great.
Shortage of OTs for a reason.
Oh, God.
There's a
All
shortage
I'm
of
saying
all health
is, if you want
professionals.
strength in your life, go OT. If you want
Just to answer, I think your name's Emeka. How can you join House of Medics? All you have to do is go to our Instagram page, which is run by Dr. Emma. So if you go to our Instagram page, make sure you're following us, send the Instagram page a DM, and then Dr. Emma will reply to you straight away. But you're already part because you're watching it, so you're already part of House of Medics. So welcome. So yeah, I'd go for OT. I don't know. I feel like you guys
Because she
are a
wants
bit
to help
more.
the shortage.
Maybe obviously you guys need the help, and I feel like I would consider myself as a people person. So I think you guys work a bit more. It's just a bit more. No, it's just a bit more personal. Like I think you take the time to actually assess. Okay, how can I actually make your life better?
Like paperwork.
But I feel like for a PT, it's just like, okay, so this is what you would usually do to get back to here. Not saying it's a bad thing, because again, guys, I'm not a medic. I do entertainment stuff, but that's just my personal. But
Take it. We still love them anyways.
yes,
we still love them.
you have to work together. But it's been an amazing panel. So thank you guys so much for coming on. We have been chatting and talking for over an hour now.
You've been an amazing host. You made it very entertaining.
Thank you very much.
Loved
So
it.
tell us your socials. I'm sure there's a lot of students that want to actually reach out to you guys. Do you guys offer mentorship?
Yeah.
Yeah, open to mentorship. Amazing. Lovely. So do you want to start telling us
Let's
your
start with the
socials?
OT. You want to be an OT?
It's
so.
true.
I would say through for kind of mentorship and things, I have a Black OT network, so that's blocked BLOT_network. So if you want any help from student level right the way up through, hit us up there and we can show you mentorship. And then privately, mine is Intentional with I think 3 L's in the ELLLE, so you can hit me up there as well.
Amazing. Thank you.
So mine is Jen Okolo, JENOKOLO. So you can definitely DM me if you want to ask any questions from student level to career progression.
The senior level.
And then I also run a women's empowerment network, and we talk about careers. It's very career focused, which is called SASA. So you can check us out on We Are
How do you spell
SASA.
that?
We Are SASA_.
Amazing.
So check out the website.
Thank you. Sabrina.
So best
And your clinic as well, don't forget.
Yeah.
Like that. Please.
If you jump onto Instagram, my Instagram is @physicalhealththerapy_. Through there, go onto the bio, you've got a link tree and you can find my clinic, details, websites and all.
What's the clinic called?
Physical health therapy.
That's amazing, guys. Make sure, I mean, my back, yeah, everyone knows. I'm going to be DMing you and stuff, but
Come through.
Dayzee.
So I don't have a physio focused social. However, you can you can find me on my personal social. It is Day Darling, which is DAYDAY Darling. On Instagram.
That suits your voice, Dayzee darling. Like, I get that. It suits your personality very, very well. Amazing. So let me go to I don't want to say this wrong because I will say this wrong. So you can follow us. House of Medics website is houseofmedics.org. On TikTok and Instagram, it is We Are House of Medics, and Twitter and LinkedIn, it's House of Medics. Thank you guys so much. It's been an absolutely, I really enjoyed this panel. I really did. So thank you so much for coming on.
Thank you so much.
Thank you, family, for watching us, and we will see you again in 2 weeks. Make sure you're on.
Thank you.
See you
Bye.
later. Bye.